For more than a century, the Piedmont brand has stood for healthcare excellence. While history will never change, we've evolved into a comprehensive system of care with a renewed focus on patients first and medical expertise fueled by a promise of service and compassion. Now we're changing how we communicate the essence of Piedmont Healthcare with a new logo and a new campaign message. Piedmont, it's time to get better.
You have never been so happy, dancing, swinging, laughing at me, smile on my face. It's happiness for days. You are everything I need. Happy ever after we'll be. Couldn't even dream a better, couldn't even dream a better way.
Hi, I'm Denise Siren with the Centers for Medicare and Medicaid Services. If you have a minute, I have some important news about how Medicare is helping to combat two common illnesses. May is National High Blood Pressure Education Month. High blood pressure or hypertension is a major risk factor for stroke, heart failure, and chronic kidney disease. May is also Osteoporosis Awareness and Prevention Month. Osteoporosis, or the loss of bone density, is the most common type of bone disease. Medicare is helping to combat the prevalence of these conditions with free annual wellness visits. As a part of Medicare's preventive benefits, you may be eligible for both cardiovascular screenings and bone mass measurements. Go online to mymedicare.gov for a 2-year calendar to track the preventive services available to you. For information on more ways to combat hypertension and osteoporosis, visit our website at medicare.gov or call 1-800-MEDICARE.
I have worked at a lot of hospitals, and I can tell you that both as a physician and as a patient, there is no other hospital like Piedmont Hospital.
You can feel it when you walk in the doors. The whole environment is very, palpable, that it's very patient-oriented, and it's very different from other hospitals if you spend time in other hospitals.
At some hospitals, the physicians who are, most of whom are very, very good, are operating independently of each other. And here, we truly work as a team.
Every part of the hospital has been very supportive, both the nursing care and the operating room.
Piedmont has a culture, and this is not my first job out of fellowship, and I think sometimes if you've been other places, you can appreciate a culture of an institution more when you first get started. A lot of people spend millions of dollars in trying to educate their employees to behave the way Piedmont does as an institution. And that's just an example, and I think that spills over into how we care for patients on a day-to-day basis.
I love working at Piedmont. I've been here almost 10 years.
I've been here for 11 years.
I've been there for 17 years.
18 years. I've been at Piedmont for almost 20 years.
I've been working at Piedmont now for 33 years. It's been one of the great blessings and joys of my life.
They've become my family. I wouldn't go anywhere else.
Piedmont has great depth of resources. We have tremendous ICU, we have tremendous anesthesia teams.
They're not afraid to give us the latest and the greatest in terms of supplies, and really have made a commitment to the community to make this a good place to be a patient.
I think Piedmont's the best hospital in Georgia.
Very happy and very proud to be a physician there.
Piedmont is a great institution. My family members have had surgery here. My friends have surgery here.
The staff is excellent, patients are great, support is excellent, so it's a great place to practice medicine.
I find it very, very rewarding just to be able to make a difference in people's lives.
To be able to take someone that's my friend that has a problem and to restore them to function and to hear, "Thanks, Doc," that's the greatest high there is.
I'm Dr. Grace Mott.
I'm Dr. Lindley Durrett.
I am Dr. Russell Flint.
I'm Vivek Rajagopal.
I'm Dr. Charlie Brown.
I'm Dr. Randy Yonda.
I'm Dr. Lillian Shapiro.
I'm Dr. Vincent Molinari.
I'm Dr. William McClatchy.
I'm Dr. Sheldon Shore.
I'm Dr. Patrick Coleman.
I'm Dr. Eric.
Oh, my love, blue skies above, we dance in time. This softly whispering I love you only. Oh my love, your heart's in mine.
My name is Dr. Robert Miller, and I am Chief of Wound Care and Hyperbarics at Piedmont Hospital. I got my training at Eastern Virginia Medical School, and my surgical training was done at Boston at Brigham and Women's Hospital and Children's Hospital. I got into hyperbaric medicine because I got involved in wound care here at Piedmont Hospital, and hyperbarics is just another modality for wound care healing. I actually started training as a plastic surgeon, and as an offshoot of dealing with wounds, especially at the Shepherd Center, I became involved in wound care healing, got involved with our inpatient staff here with wound care, started the wound care program, got certified by the American Board of Wound Care Management, and then got certified in hyperbaric medicine. I've been here at Piedmont Hospital since 1992, and I love working here. I think that the nurses and the staff and the physical therapists are the best to work with in the city. The thing that I like the most about wound care is just the interaction with patients. We see them very frequently. We become very intimately involved in their lives. And the thing that I enjoy is taking someone who's basically being chained by a wound and freeing up to return to their lives. My name is Dr. Rob Miller.